Hello, I'm Belinda, and for the past 30 months I've been on a medically supervised GLP-1 journey to improve my health, my well-being, and through weight loss. And I did it. I've lost 6 stone. But the biggest question I get asked nowadays is what happens when you actually reach your goal weight? Is your doctor still going to prescribe you your medication? And also, the big question is, should he prescribe the medication if you have reached your goal weight? So to answer that question, I have to keep reminding people that obesity is a chronic relapsing disease. And these GLP-1 medications are not a cure for obesity, they are a treatment. Just like how people with high blood pressure or diabetes stay on their medications long term. The misconception is many people assume weight loss is the end goal, but obesity is about more than just weight, it's about your metabolic health. So from a medical perspective, asking your doctor if he will continue to prescribe this medication, it'll vary, doctors do vary in their approach. Some will think, continuing the medication because they know and they have the knowledge that obesity is a chronic relapsing disease, but some may encourage you to kind of taper off due to, limited availability, due to cost, or due to the belief that weight loss is complete once you have reached your goal weight. But like scientific research, studies show that stopping GLP-1 medications can lead to weight regain, often due to increased hunger, slower metabolism, and food noise returning, which is something we never want to return to, ever. So if we look at what the guidelines say, many obesity specialists recommend continuing the treatment if you have reached your goal weight and you're having metabolic benefits from it, and it helps you maintain a healthy relationship with food, which it does, it really does. And some people and some patients can kind of transition down and they'll find their sweet spot where they don't have hunger and they don't have food noise, and they can stay at that level of medication for quite some time then if they're not gaining weight, and then go back up if they do, and you just have to find your spot, your sweet spot. But what happens if you do just come off the medication? Like I just said, mostly you will put up weight. Your body is wired to regain lost weight. That's metabolic adaptation. It's like the set point. I've done a video on that before as well. And the food noise and the hunger will return, and it will return in a matter of weeks, if not days, of being off your medication. And then of course there's the mental and emotional impact as well, having to deal with hunger again, especially for somebody like me that will probably reach their goal weight in the next 6 to 8 months. Because I'll hopefully be going into maintenance then. I will not be looking forward to coming off, I would not be looking forward to coming off the medication if I was told to do so. I don't think I would be able. I'm not going to. So what can we do to advocate for ourselves if our doctor thinks that we should come off this medication? So if your doctor is suggesting stopping, here's how to advocate for continued treatment. Frame it as if it's a chronic condition. Ask him the question, would you take insulin away from a diabetic who has stabilized their blood sugar? Okay, that's one. Maybe discuss maintenance dosing. Many doctors support staying on this long term at a lower dose, and then focus on health beyond the weigh-in scales with him. Talk about your energy level, have a look at your blood sugars, how you're controlling those, have a look at your blood pressure, your overall well-being, and if your doctor does refuse, consider seeking a second opinion, particularly from an obesity specialist, and I will put the name of one in the comments. So I just want to reinforce the core message of this video, okay? That GLP-1s are not just about weight loss. They treat a chronic disease that doesn't go away because you hit a number on the scales. That's not what this is about, It is a chronic disease. There's medication there to treat it, not to cure it. So I'm just wondering if anyone at this point has gone into their doctor after hitting their goal and spoken to them about this. I'd love to hear what your experiences were. You can DM me on my Instagram or just drop a comment below. I'd be really interested. And don't forget to hit subscribe and click the bell so you'll get notified every time I make a new video.